Hi, this is Whitney Owens at Water's Edge Counseling. In this video, we're going to talk about the symptoms of postpartum depression and baby blues and talk about the difference in those symptoms. Like in the first video, we talked about how the baby blues are a time period that lasts 2 weeks after delivery. If mom is still feeling isolated, down, depressed, anxious after those 2 weeks, it's considered to be postpartum depression. If left untreated, depression not only affects the health of the mother, but it also affects the health of the baby and the entire family. It can make it difficult to mom find connection with her child, difficult for mom to care for her child. So you don't want to ignore the symptoms that one's experiencing after the first few weeks after birth. This may cause the baby to have difficulty with eating, difficulty with sleeping. Baby may have other behaviors associated with it because they're not feeling as cared for and its needs is met because mom's needs aren't being met. So it's really important that we meet mom's needs so that mom can best meet the baby's needs. So if you're a mom and you're feeling overwhelmed and feeling exhausted and feeling depressed and anxious for weeks after delivery, you really need to pay attention to that and get some help, because it's not only you, but it's your children or your spouse that can be affected by that. So some of the symptoms that women experience who have postpartum depression, the 2 weeks after delivery or further, is oversleeping or not sleeping enough. So it's important to notice how much time you're actually spending sleeping, making sure you're getting naps between when the baby is napping, or getting extra help so that you can sleep, because you want to keep up with that. Mom is also feeling disconnected, maybe from friends and from family and from their baby. That disconnected feeling is important to notice because that can be a symptom of depression. If mom is feeling doubtful about herself and her abilities, that's another symptom of postpartum depression. If mom's having thoughts of suicide, just even if it's little thoughts about maybe life would be better without me, don't ignore that. Go and get help before it escalates to something worse, or call a crisis line or go to the emergency room if you're feeling scared about hurting yourself or your child. So but typically those feelings will start small, where you're just feeling kind of lonely and upset. So it's important that you pay attention to that before it becomes something else. If mom is having a hard time eating, either overeating or undereating, that would be another sign of depression. Hopelessness, extra feelings of guilt, and panic to the point where they can't take care of themselves or their baby. These are all things that are to be considered. And so if you're experiencing that more than 2 weeks after delivery, talk to your support system, your spouse, your close friends, your parents. Let them know how you're feeling. Get extra support from them. Get help sleeping. Get help with food. Get help with caring for your baby. And if you're still feeling down after that, I encourage you to talk to a counselor, to talk to your doctor about your symptoms and get help. It's a highly treatable disorder, and you can feel better within a matter of weeks if you start getting help now.